Hello, and welcome to Teaming Basics for Safe Harbor. I'm Sarah Florman, and I'm the Trafficking Policy Coordinator with the Sexual Violence Justice Institute at the Minnesota Coalition Against Sexual Assault. Today, I'm going to share some foundational information for systems professionals who are interested in forming a multidisciplinary team, or MDT, to address the response to sexual exploitation and trafficking in their communities. We'll start with what multidisciplinary teams are and what they're used for, and then we'll talk about some of the key disciplines that you should consider including in your Safe Harbor multidisciplinary team. And then we'll spend some time on the fundamentals for successful teaming. Safe Harbor multidisciplinary teams are comprised of individuals involved in the community response to sexual exploitation and trafficking. Because Minnesota's Safe Harbor laws are relatively new, we as a state are still working to figure out where and how the response fits within existing systems. Because of this, collaboration is essential, both for ensuring positive outcomes for sexually exploited youth and for systems professionals to coordinate their response. Keeping the youth at the center is a fundamental of Minnesota's No Wrong Door model, which emphasizes a victim-centered process and encourages viewing the youth's definition of success as the ultimate goal. MDTs help systems professionals to work together to solve problems and improve services. For Safe Harbor, MDTs are an opportunity for service providers, social workers, and other professionals to coordinate their services. It ensures that everyone is working in tandem toward the same goal, and it prevents duplication of efforts. It's really common in communities for elements of the system's response to be siloed apart from one another, and collaboration with other disciplines is not usually emphasized or encouraged. MDTs provide a means to break down those silos. MDTs improve collaboration among systems professionals in a number of ways. They provide an opportunity for folks to form connections and build relationships with people in other disciplines. Especially in Safe Harbor work, where there are often several people involved in a youth's case, having the chance to meet face-to-face can make a huge difference in the quality of services the youth receives. Professionals can better understand each discipline's role and how it intersects with their own. If you think about it, when you've got a complicated case and you need to consult, how much more likely are you to reach out to someone you know? MDTs are a great way to build those networks and tap into additional resources. MDTs involve professionals across disciplines, and each one has a unique role and perspective that they operate from. For an example, an advocate is usually focused on what the victim survivor wants or needs, while child protection might be focused on the youth's overall safety, and law enforcement might be focused on investigating the exploiter or trafficker. When looking at ultimate goals, the goal for child protection might be successful placement or family reunification. For law enforcement, success might look like arresting a trafficker, and for prosecution, it might be winning a case. These differences can be really tough to navigate because a lot of these frameworks seem to contradict one another. This is where ensuring that your MDT is victim-centered is key. If the ultimate goal for each team member is the best outcome for the youth, it helps people to refocus and to start changing their idea of what a successful outcome might be. One of the real benefits to MDT work is learning to widen your scope to include the whole picture. You learn to see your role as a part of a larger response and better understand that your goals might not line up with the best outcome for the youth. An example of this is a victim of trafficking who does not want to testify against their trafficker. For that youth, a successful outcome might be receiving mental health or housing services. This can conflict with law enforcement and prosecution, whose measures of success generally involve arrests and convictions. Another example is placement. A child protection worker might feel that a Safe Harbor shelter is the best choice for the youth, but perhaps that youth has a child of their own, and the shelter doesn't accept parenting youth. In this case, the child protection worker might need to change their idea of what an appropriate placement looks like. MDTs can improve outcomes for both the youth and their team members. When systems professionals focus on the big picture rather than just their unique role, teams can improve the overall experience for victim survivors by streamlining the process and removing barriers. One really critical area this can affect is the victim interview. When law enforcement, prosecution, and child protection work together, it might be possible for a youth to only have to tell their story once, as opposed to over and over at each stage in the process, therefore re-traumatizing them. As a bonus, better collaboration and coordination among disciplines often improves performance and job satisfaction for team members because it makes the work easier and more rewarding. Multidisciplinary teaming is a tool that's used for a variety of system responses. Some of these include child protection, case consultations, task forces, law enforcement operations, cross-training, and protocol development. Each type of MDT has a unique purpose and goal, but might include many of the same team members. Consider your primary goal when you're forming your MDT. This will affect who you approach to join your team. Also find out if there are any existing MDTs in your community that can be tapped to address your issue. There are a number of agencies and disciplines involved in the Safe Harbor response. Today, we'll focus on 6 that are essential to improving outcomes for victim survivors. I want to emphasize that these are not the only 6 professions you may want to include, and there might be communities where not all of these disciplines are represented. We will talk later on about what to do in that situation. It's also important to consider that in addition to systems professionals, your MDT should include the perspectives of victim survivors, diverse communities, and special populations that are unique to your area. For this introduction, however, we're going to focus on the core systems professionals you want to include. First off is advocacy, which includes both systems-based and community-based advocates. This involves safe harbor service providers, such as regional navigators and program staff, as well as government-based victim witness advocates. It's generally the role of the advocate to provide support, counseling, and information to victim survivors. They often connect youth with resources and help guide them through the various systems. The advocate is often with the youth through most or all of their experience with the system's response, whereas folks in other disciplines may only have contact with the youth during their discrete role in the response. This gives the advocate the advantage of being able to provide the team with an understanding of how the youth experiences the system's response and be able to recommend improvements through a victim-centered lens. Child protection and child welfare professionals are able to address the family response and provide safe placement alternatives if needed. Many sexually exploited youth and their families may already have involvement with child protection or child welfare, and workers are often in a position to identify youth who may have been sexually exploited or trafficked. In addition, child protection is required to investigate all incidents of alleged child sex trafficking. Even with safe harbor laws in place, juvenile corrections and probation professionals may have contact with sexually exploited youth who are involved in the criminal justice system, as many of these youth engage in delinquent activity that may or may not be related to their exploitation. These youth may already be on probation or may end up placed in detention or correctional facilities, and it may not be previously known that these youth have been exploited or trafficked. These professionals should be on the lookout for risk factors and red flags in all the youth they work with. Healthcare professionals are often the first to identify issues of exploitation and trafficking when working with patients. This may be a sexual assault nurse examiner, emergency room staff, or other designated responders. In addition, youth who have been exploited or trafficked often have immediate or long-term medical needs, such as injuries due to physical or sexual abuse, sexual assault examinations, STI or pregnancy testing, or birth control. Law enforcement may encounter sexually exploited or trafficked youth as part of a sting operation or investigation of suspected traffickers. They may also have contact with them in other circumstances where the sexually exploited youth is involved in other crimes or delinquent activities such as running away. All law enforcement, including patrol and investigators, should be part of the multidisciplinary response, as the victim's first interaction with police often affects their decision to come forward and seek help. Prosecutors may work with sexually exploited and trafficked youth as victims or witnesses, or as defendants in other cases. There may also be times when a prosecutor finds that the line between victim and defendant is blurred. Victims of trafficking and exploitation are frequently involved in other crimes, and they might even be involved in recruiting and trafficking other victims. How to handle these cases can be a difficult decision, and prosecutors can benefit from engaging the MDT to better understand the whole picture of a youth's involvement in a crime. Participation in multidisciplinary teaming requires an ongoing feedback loop between the agencies and team members. This process needs to start with the agency, and the team member should be speaking on behalf of their agency rather than themselves. This ensures your team is not simply a group of people with great ideas and no power to affect change. It's also really important to consider how you're going to ensure this communication. Think about potential methods as well as possible barriers for facilitating this communication process. The Sexual Violence Justice Institute at MnCASA works with multidisciplinary teams across the United States, and those teams have helped us to determine some of the keys to success for MDTs. These keys to success can be grouped into 6 major themes: clear mission, purpose, and vision, valuing collaboration and respect for unique roles, active participation, multi-level leadership and agency buy-in, a focus on improving the response, and an understanding that the little things are important. We'll dive into each of these themes now. Clear mission, vision, and purpose. Teams should have a clearly stated purpose toward improving the system response to sexual exploitation. Consider who you are as a community, what is the purpose of your team, and who is this work going to benefit? Make sure that your value statements are specific to your community and that they are actionable. For example, you might want to increase reporting of exploitation and trafficking in your community, or you might want to increase the number of prosecutions of traffickers or buyers. Make sure that you're setting realistic goals. For example, the total eradication of sexual exploitation and trafficking of youth is probably going to require a lot more than your MDT can provide. So make sure that you focus on improving the response and the overall experience for victim survivors. Keep the mission and vision of your team central to the work that you do. Make sure to document and review them often, and check in with the team to make sure that the work you're doing is in line with the mission. You also want to consider whether the mission might evolve over time and how to navigate those changes. Here's a sample mission statement. The SVJI County Safe Harbor Response Team exists to create and implement a victim-centered multi-agency response to meet the needs of youth who experience sexual exploitation and trafficking. Note the specifics in the mission statement. They specifically state victim-centered response. They specifically state that they're working to meet the needs of youth and that they're working with youth who've experienced exploitation and trafficking specifically. Make sure that your MDT defines what terms like victim-centered or trauma-informed mean for the team, and that all the members are operating under that shared understanding. The team values collaboration and respects unique roles. MDTs provide both formal and informal opportunities for networking and connecting to generate ideas and build relationships. Team members should value the collaborative process and truly see themselves as part of a team working toward a shared goal. They should look to one another for information and be open to sharing resources. Teams should also find ways to address conflicts and provide feedback to one another that is constructive and not personalized. Improving the response will require folks to make some changes, so it's critical to address barriers and inefficiencies across the system's response. Resiliency is a key factor as well. This means that the team knows that setbacks might happen and that the team will recover. An example of this is employee turnover. Your team needs to be stronger than the sum of its parts. Multidisciplinary work is hard, and so are the professions of your team members. Turnover is an unavoidable part of systems work, and the key is to remember that the process of multidisciplinary teaming is not going to be trouble-free, but the team will be able to work through those troubles together and bounce back. It's important that the whole team values each team member's role and views them as equally important in the response. Collaboration needs to involve a give and take from all sides, and no one team member's agency should be the one making or demanding all the concessions. Active participation. All team members should regularly participate in meetings and activities and follow through on projects. Do realize that participation may look different for different individuals, so try to provide multiple opportunities and means for people to engage. For example, some people might not feel comfortable speaking up in a large group. Offer the option of asking questions or providing feedback via email. Some folks might prefer to have time to process their thoughts and write out their responses. And some team members do best when working in small groups. All team members should have the opportunity to help generate those ideas and contribute to the work in a meaningful way. Multi-level leadership and agency buy-in. Try to ensure that your team has members at all levels of leadership, but that there are enough people at the table with the authority to influence their agency's policies. Each organization needs to be willing to allocate resources and staff time to support the agency's role on the team, and they need to be committed to responding collaboratively to sexual exploitation. Participating organizations must be increasingly open to change in their own agency policies and practice over time. One tool that can be really helpful when forming a team is the Memorandum of Understanding, or MOU. This document uses the power of the team to prompt necessary change within agencies and across systems. It makes it clear what each agency is agreeing to, including the purpose of the MDT, and their particular role and responsibility within the team, including the limitations of each team member. The MOU should also outline a process for addressing grievances or concerns among team members or participating agencies. Improving the response. For all types of MDT, the overarching goal is to improve the response. The work of an MDT involves taking a hard look at the current systems and identifying gaps and areas of need. The team then needs to consider how to take action on these issues, with each member being willing to make changes within their own organization. The process is one of continuous improvement, and there should always be opportunities to identify strengths and weaknesses in the system's response. Your team should regularly measure, evaluate, and reflect on its impact to refine its goals and activities. If your MDT is struggling to have these conversations, it is unlikely that any successful substantial improvements are being made to the response. When you're evaluating outcomes, make sure that you're gathering information from a variety of sources to ensure quality. An example of this could be getting feedback from youth at various points within the system, surveying systems professionals on how the process has improved for them, or talking with community members about what improvements or gaps they might see. The little things are important. Early on, have your team members develop agreements around group values and norms, and refer to them often. Decide what you're planning to expect from one another, how you want to interact and address conflicts, and how your time will be used. I'll give some examples of this in a moment. You should also discuss a structured plan and process for your meetings, including consistent scheduling and meeting space, leadership and decision-making methods, and delegation of responsibilities. These are some examples of team agreements made by Safe Harbor MDTs. Be committed and prepared. Maximize meeting time and stay on task. Challenge each other to reach the next level. Be open-minded. Assume positive intent. Consistent participation. Be willing to compromise. These agreements should be centered around the questions of how we want to engage with one another, what type of collaboration do we want to have, and how are we going to go about doing that. These agreements are a really good starting point for addressing power differentials between disciplines. In Safe Harbor teams, there can be a lot of different dynamics at play and various types of power being exercised. The agency leading the team has one type of power, government officials have another. Law enforcement has yet another, including the fact that they might come to meetings literally armed. Even team members with the best intentions may consciously or unconsciously exert power. It helps to bring up these types of concerns before they actually occur because it keeps the conversation from being about a specific person or incident, and it can prevent problems before they start. Teams should take time to think about potential situations where tensions and power dynamics tend to pop up. When it comes to logistics, it's really important to remember that members of multidisciplinary teams have full-time jobs on top of their involvement with the team. Be considerate of one another's time and available capacity. So things to consider include frequency and length of meetings, location, who's in charge, what are the expectations for individual team members, and what are their roles within the team? What's the decision-making process? Do we take a vote? Are decisions made by consensus or do they need to be unanimous? Who breaks ties? You also want to consider things like what is the distance that each team member will have to travel to attend these meetings, and how much time do members have to commit to these meetings? You also really want to think about your use of meeting time. What needs to be done in the large meeting versus smaller subcommittees or individually? An example of this is that you probably don't want to draft protocol in the large meeting itself. You probably want to do that in a small group or subcommittee and then bring that draft back to the larger group for feedback and review. The most critical piece of multidisciplinary teamwork is addressing tensions and barriers within systems and between disciplines. Some disciplines have a history of conflict with one another, such as advocacy and law enforcement. In other teams, there may be a history between two individual team members related to a previous interaction. All of these are common, and working through them strengthens the overall system's response. Some of the tensions within the safe harbor response might include things like conflict over concepts. So different disciplines may have different ideas of what some concepts mean. An example of this is safety. For law enforcement, safety might mean that the exploiter or trafficker is removed from society. For child protection, it might be about whether the youth should remain at home or be placed elsewhere. For advocacy, it might mean using a harm reduction framework, maintaining the youth's autonomy and choice as much as possible. Another area of tension is often confidentiality, because each discipline has its own unique considerations and requirements surrounding sharing of information. All of these different requirements are valid and need to be made clear to the team as a whole. A lot of problems can be prevented by discussing why you can or cannot talk about a certain thing in a meeting before it becomes an issue. Disciplines may have different goals and definitions of success. Again, the example of law enforcement seeing success as making an arrest, prosecution getting a conviction, child protection finding safe placement, etc. In a victim-centered approach, the team should focus on the youth's definition of success, which may not fit with your views and may look different for each youth you work with. Each team member will have to work on shifting their mindset to this big picture idea of success. These tension points are why MDTs are so important. The process allows for communication and feedback between professionals that is victim-centered and non-blaming. These tension points are where systems break down and youth get lost in the shuffle. It's a really frequent habit for teams to avoid these conversations or to pay lip service to them. But these are the key places in the system's response where victim survivors are the most negatively affected. Avoiding these critical conversations can result in a breakdown of team dynamics or in team decisions that aren't respected or enforced. Have you ever been part of a team where everyone agreed to a decision and then went out into the parking lot and talked to one another about why they would not be following that decision? That type of teaming is not effective. If you're not having these conversations about tensions and barriers, how are you improving the response for victim survivors? Now that we've talked about the basics of Safe Harbor MDTs, here are some steps you can take to do this work in your communities. First, talk with your agency's leadership about the benefits of collaboration and teaming with other disciplines. Emphasize how it can help improve each agency's success and satisfaction. Really think about what motivates leadership and leverage that to gain their buy-in. Use your networks. Talk with professionals you work with regularly. Start having the conversation about how to improve your coordination. Use those connections to engage others. Advocates in Safe Harbor often work with child protection. This is a great opportunity for folks in these disciplines to find people that they've developed good relationships with and then take that to the next level. Find partners. It might be difficult to get buy-in from all the disciplines at the beginning, and not all organizations will be ready to do the work. So start with a few members, start where you're at, and gain some positive momentum and success. Other agencies are going to want to be a part of something that works. An example of this is maybe a countywide team that has 1 or 2 police departments participating. But if other law enforcement in the county sees that it's working well for those police departments, they're more likely to see how they can benefit too. Positive response from the community can also help leverage support and buy-in from public officials. A real-life example of this involved one MDT that worked to gain the support of the 2 individuals running for county sheriff. They were able to get both candidates to pledge their support and cooperation to the Safe Harbor MDT because the community members, also known as the voters, made it clear that the issue of sexual exploitation and trafficking mattered to them. You can also look at what similar communities are doing across the state. Every community has its own set of needs and resources, but you should be open to borrowing from and sharing with your neighbors. This can be especially beneficial in addressing gaps in services or other limitations. If your community is in a rural area and lacks, for example, a SANE nurse, find out if a neighboring community has found a workaround for this. Or maybe they have a SANE nurse themselves, and you can form an agreement to access that resource. Finally, craft your sales pitch. Come up with a way to quickly describe the purpose of your team and the potential benefits to participating. Most professionals who are very busy people will not react very favorably toward a request for them to expend additional time and energy unless there's an understanding of what's in it for them. Make it really clear how participation will make their job easier. Finally, the Safe Harbor Readiness Assessment is a tool that you can use to evaluate whether your community is prepared to respond to sexually exploited and trafficked youth. The assessment is a set of questions that help you determine where you currently stand, what improvements or changes you need to make right away, and what are your community's biggest strengths. It's important to have multiple people from various agencies and disciplines complete the assessment. This will give you an opportunity to really ground yourself in what your team needs the most, and this can help shape your initial meetings and process. In addition, addressing issues of team sustainability and turnover at the start can really help with resiliency. Turnover is a very normal part of multidisciplinary teamwork, and it's a good idea to have plans in place for incorporating new members and maintaining the team's core competencies. Thanks for watching this introduction to Safe Harbor teaming. If you have any additional questions, please feel free to contact me or the Minnesota Coalition Against Sexual Assault